Hi, my name is Ashley Lucas, and I'm going to present a patient from Glacier Hills Care Facility. Patient is a 75-year-old married African American female. Her former job was a nurse in intensive cardiac care. Patient was transferred from the University of Michigan Hospital to Glacier Hills on December 18, 2015 for treatment of a subarachnoid hemorrhage following injury without open intracranial wounds and with brief loss of consciousness. Patient complains of impaired physical mobility related to the paralysis of the right side of her body and fractured clavicle and ribs on the left side, as evidenced by slow movement, abnormal gait, and limited range of motion during physical activity. Patient states that she does not feel pain upon performing daily activities and denies suffering from aggravating factors. Patient complains of being unable to perform physical therapy because of the sling on her arm from her left clavicle fracture. Vital signs are stable. Blood pressure is 127/83, heart rate is 98, respiratory rate is 16, and temperature is 36.6 degrees Celsius taken orally. Past medical history includes chronic seizures, lumbar stenosis, chronic meningioma, depression, osteoporosis, iron deficiency anemia, lupus, chronic bilateral carpal tunnel, a clavicle fracture, and hypokalemia. All immunizations are up to date. No known drug allergies. Past surgical history. Brain surgery for parietal meningioma in 2010. Patient is on numerous medications for blood pressure, seizures, diabetes, and constipation. Functional assessment. Patient denies alcohol and drug use and states she quit smoking 42 years ago. Patient states she does not have an exercise regimen because of her limited mobility caused by her paralysis. Patient states that she has normal sleeping patterns, but due to her diabetes, has to watch her nutrition. Patient drinks coffee regularly and states she has on average 12 cups a day. Psychosocial. Patient currently lives with her husband in Ann Arbor. She states that she has many friends and is close with her 4 children. There are currently no members of her immediate family that are living. Patient denies having suffered from many stressors. She remains positive about her current health status, but admits to suffering from depression for a few days after her first fall. Coping mechanisms include going to church and participating in social activities. Patient is very spiritual and identifies herself as being Catholic. Family history. Patient states that her father died from diabetes at age 60 and that they are the only ones in the family who suffer from this condition. Her mother died at age 62, but she reports no other family history of disease. Cardiac. Because of patient's diagnosis of hypertension, it is important to assess the status of her condition regularly. Patient denies having experienced changes in performing activities specifically related to her hypertension. She reports that she has not experienced severe shifts in her weight and has never been diagnosed with myocardial infarction, congestive heart failure, arterial sclerosis, coronary artery disease, angina, or arrhythmia. She also denies suffering from infections such as rheumatic fever, endocarditis, or pericarditis, or having an angioplasty, pacemaker, defibrillator, or valve replacement. Patient suffers from hypertension and diabetes, but reports that she does not have elevated cholesterol or triglyceride levels. Upon inspection, no heaves or lifts are present over the aortic, pulmonic, Erb's point, tricuspid, or mitral areas, and there was no apparent edema, increased respiratory effort, or cyanosis. When palpating the chest over the 5 key areas, lifts and thrills were also absent. There were no S3 or S4 sounds, and the point of maximal impact had a strong, regular pulse. Normal heart sounds were heard at each area, but patient reports having experienced murmurs caused by turbulent blood flow, possibly from decreased blood viscosity due to her anemia. Musculoskeletal. Due to her osteoporosis and bilateral carpal tunnel, it is important that a musculoskeletal assessment be performed regularly. Patient states that she has experienced changes in mobility attributed to paralysis of her right side, as well as fracture of her left clavicle. For support, patient uses a wheelchair and walker. She suffers from several neuromuscular disorders, including lupus, osteoporosis, narrowing of her spinal cord, and carpal tunnel. Upon inspection, patient appears to have an abnormal gait, a spine that deviates from midline, and unparalleled scapula and hips that indicate scoliosis. She has an erect posture. Her muscles are symmetric in size and shape, and her extremities are of equal length. Upon palpation, her temporomandibular joint, neck, shoulders, as well as her elbow, wrist, fingers, hip, knee, ankle, and spine on her left side had active and complete range of motion and do not have any swelling, redness, tenderness, warmth, or crepitus present. Patient rates of foreign muscular strength for her left deltoid, bicep, tricep, wrist, finger, hip, hamstring, quadricep, and ankle. Paralysis of right side impedes patient's ability to perform range of motion or test muscle strength and joints found on the right side. Pertinent system number 1, integumentary. Patient was diagnosed with lupus at age 23, a disease that affects the integumentary system and, according to an article on healthline.com, produces a butterfly-shaped rash on the bridge of the nose. Additionally, lupus can cause skin ulcers on the inside of the nose, mouth, or tongue, and inflammation that results in thinning of hair, loss of eyelashes, eyebrows, facial, and body hair. According to an article published by the Lupus Foundation of America, approximately 90% of individuals diagnosed with the disease are women. It is 2 to 3 times more likely among women of color, and between 10 and 15% of people with lupus will die prematurely due to complications of the disease. Because the patient's gender and race places her at increased risk, it is therefore critical to assess her skin to know any drastic changes in her condition regularly. Pertinent system number 2, neurological. A neurological exam should be performed on this patient in order to assess for depression related to her paralysis and limited range of motion that prevents her from performing her regular ADLs. According to the Christopher and Dana Reeve Foundation Paralysis and Resource Center, 20 to 30% of people with long-term disability suffered from depression. Depression affects individuals in different ways. It can involve major changes in mood, outlook, ambition, problem-solving, activity level, energy, and appetite. People who are depressed may not look after themselves, they may not drink enough water, take care of their hygiene, or manage their diet. In order for the patient to improve their condition or remain at her current health status, it is therefore critical to monitor depressive symptoms that prevent her from getting better. If not regularly assessed, the comorbid disorders the patient suffers from, such as her lumbar stenosis, osteoporosis, anemia, and carpal tunnel, could also worsen as a result of her inadequate nutrition and overall health.